Are you familiar with the term hypertension? You should be. Commonly known as high blood pressure, the condition affects 1 in 5 Canadian adults. Prevalence increases with age. While only 5% are diagnosed by age 20, roughly 90% of older adults will develop the condition before they reach 85. What's worse? 17% of these individuals will be unaware they have it. There are no symptoms. For this reason, it is important to have your blood pressure checked regularly. Our hearts contract to pump blood around the body. As it circulates, the blood exerts a force on the arterial walls. This is blood pressure. Normal blood pressure is 120/80, but in hypertensive individuals, pressure is consistently greater than 140/90. This elevation may be caused by an increase in blood volume or resistance in the vessels. As we age, our vessels lose elasticity and begin to narrow, impeding blood flow and forcing the heart to beat harder to move blood to our tissues. This happens as part of the normal physiological decline of aging. Additionally, blood pressure may increase as a result of an underlying disease. If left uncontrolled, excessive pressure weakens arterial walls throughout the body, increasing susceptibility to further disease. In the brain, stroke, aneurysm, and dementia are possible. In the heart, angina, heart attack, and heart failure could result. Kidney disease, peripheral arterial disease, and loss of vision may also occur. Unlike hypertension, many of these conditions are life-threatening and irreversible, so it's important to take action and manage your blood pressure. How to use pressure to reduce your blood pressure. P. Physical activity. Participating in regular physical activity is one of the most effective ways to prevent and reduce high blood pressure and other cardiovascular disease risks. Experts recommend a minimum of 30 to 60 minutes of moderate intensity dynamic exercise each day. Focus should be on aerobic activities that utilize major muscle groups to help promote blood flow. Swimming, jogging, and biking are all good options. Anything that makes you sweat a little and start to breathe harder. It doesn't have to be continuous. Shorter bouts throughout the day may be more beneficial in maintaining a lower blood pressure, as chemicals released during exercise help our vessels relax. In some instances, persistent relaxation can cause hypotension or low blood pressure, so it is important to include a proper warm-up and cool-down and to monitor your heart rate and blood pressure throughout your workout. Also, remember to stay hydrated, as older adults have a reduced thirst response. R. Reduce sodium. The average Canadian consumes 3,400 milligrams of sodium each day, more than double the recommended amount. Too much sodium or salt in the diet causes the kidneys to retain water, which increases blood volume and ultimately pressure. Try to limit intake to no more than 1,500 milligrams per day by avoiding processed and fast foods, opting for low-sodium alternatives when possible, and making a conscious effort to E. Eat healthy. Adopting a Mediterranean-style diet that incorporates a variety of fresh foods like fruits, vegetables, fish, and whole grains, while limiting unhealthy saturated fats, may be beneficial for those struggling with hypertension. Avoid sugary snacks and beverages, choose low-fat dairy products, and try preparing more home-cooked meals. Eating a well-balanced diet and getting regular exercise will help you to S. Slim down. Maintaining a healthy weight will alleviate stress on your heart and decrease the risk of high blood pressure and other serious health problems like diabetes or dyslipidemia. Talk with your doctor or dietitian to determine an appropriate weight for your age and body type. S. Stop smoking. With every cigarette smoked, blood pressure temporarily increases. Over time, the chemicals in cigarettes, namely nicotine, induce arterial stiffness and promote fatty buildup in the arteries. U. Understand your medications. It's important to discuss any drugs you take with your doctor or pharmacist, as many common medications have adverse effects on blood pressure. R. Relax. High stress is associated with higher blood pressure. Take breaks when you need to and make time for things you enjoy. Adequate sleep is also critical to your mental well-being. E. Eliminate excess alcohol. In small amounts, alcohol can be beneficial in controlling blood pressure, but excessive amounts cause your body to retain water. It's recommended that men consume no more than 2 drinks per day and women just 1. In some cases, medication may be necessary to help control hypertension, but for most, these simple lifestyle modifications are enough to reduce it to a healthy level. Start with the small things like parking farther away, walking when you can, and opting to take the stairs. Every little bit helps. Remember, it's important to know your blood pressure. You could be hypertensive and not even know it. For more information, talk to your healthcare provider or visit hypertension.ca.